Hello everyone and welcome to Know Your Drug, powered by MediInsights, the ultimate destination for all things of health and wellness from the fascinating world of medicals and pharmaceuticals. We are here to guide you on Ramucirumab injection, exploring the various aspects of Ramucirumab, their usage, dosage, mechanism of action, side effects, and most importantly, essential advice for taking them safely and responsibly. Before we begin, let me emphasize that the content provided in this channel is purely educational. Always consult a healthcare professional for personalized advice regarding medications. Now, let's get started. Use of Ramucirumab injection. Ramucirumab injection is primarily used for the treatment of various types of cancer, including advanced gastric cancer or gastroesophageal junction adenocarcinoma, metastatic colorectal cancer, and non-small cell lung cancer. It is often employed in cases where the cancer has not responded to other treatments or has recurred. Ramucirumab is typically administered in combination with other chemotherapy agents to enhance its efficacy. Dosage of Ramucirumab injection. The dosage of Ramucirumab injection varies based on the type of cancer being treated, the patient's overall health, and their response to therapy. For gastric cancer and gastroesophageal junction adenocarcinoma, the recommended dose is usually 8 mg per kg every 2 weeks. For metastatic colorectal cancer, it is often given at 8 mg per kg every 2 weeks in combination with FOLFIRI. In the case of non-small cell lung cancer, the typical dose is 10 mg per kg every 3 weeks. Administration is done via intravenous infusion, and the duration of the infusion is typically 60 minutes. Mechanism of action of Ramucirumab injection. Ramucirumab is a monoclonal antibody that targets and inhibits vascular endothelial growth factor receptor 2. By blocking vascular endothelial growth factor receptor 2, Ramucirumab disrupts the angiogenesis process, which is the formation of new blood vessels that supply the tumor with nutrients and oxygen. This inhibition effectively starves the tumor of essential resources, thereby slowing its growth and spread. Side effects of Ramucirumab injection. Common side effects of Ramucirumab injection include hypertension, diarrhea, fatigue, and decreased appetite. More serious adverse effects can occur, such as severe bleeding, gastrointestinal perforations, impaired wound healing, and infusion-related reactions. Regular monitoring by healthcare professionals is essential to manage and mitigate these risks. Important advice for using Ramucirumab injection. Patients receiving Ramucirumab should be closely monitored for signs of hypertension and other cardiovascular issues. It's important to inform healthcare providers about any history of bleeding disorders or gastrointestinal problems, as these conditions can worsen with Ramucirumab. Here are some additional points to consider. Ramucirumab can harm unborn babies. Women who are pregnant or planning to become pregnant should not take Ramucirumab. Breastfeeding is not recommended while on this medication. Ramucirumab may not be effective for everyone, and some patients may develop resistance over time. Discussing potential benefits and limitations with your doctor is essential. Due to the risk of impaired wound healing, patients should avoid undergoing surgical procedures during treatment and for at least 4 weeks after the last dose. Maintaining open communication with healthcare providers and adhering to scheduled appointments are crucial for the safe and effective use of Ramucirumab. By the end of this video, you'll have a solid understanding of the use, dosage, mechanism of action, side effects, and important advice for using Ramucirumab injection. Remember, knowledge is power, and being well informed empowers you to make the best decisions for your health.